News 5 investigates. Rural hospitals across the country have received billions of dollars in COVID-19 relief funds, but officials at Thomasville Regional Medical Center say they were cut out due to a flaw in the federal system.
As WKRG News 5's Blake Brown explains, the hospital in North Clarke County is now strapped for cash, and they're asking, where's the money?
Healthcare in rural South Alabama is everything for small communities like Thomasville.
We built this facility with a vision to provide health care close to home, not have people drive 100 miles to get a mammogram or a bone density test or an MRI.
Thomasville Regional Medical Center opening its doors in March 2020 with roughly $3 to $4 million set aside to ramp up operations in its first year. CEO Curtis James says just 2 weeks later, though, COVID-19 hit the healthcare system hard, forcing doctors to cancel elective surgeries and hospitals to change their operations with little warning. Mayor Sheldon Day says it was tough.
Our biggest moneymaker that we opened our hospital for, we had to shut down immediately after opening.
We thought we had enough capital runway to make it to cash flow positive situation. We went back after about 6 months after opening, again, because we got no COVID relief funding, none.
The hospital struggling through the first few months of the pandemic, forced to refinance in late 2020 in order to prepare for the weeks and months ahead.
The CARES Act that the federal government passed really relieved hospitals that were in business in 2019. Since we didn't start to 2020, there was a misconception that we would be taken care of in CARES Act relief money. We got zero CARES Act relief money, and other hospitals in this region got 8, 9 million, even 13 million.
As of March 2022, Thomasville Regional Medical Center staff say they've only received $1 million of federal funding from the U.S. Department of Health and Human Services, or HHS, through their Provider Relief Fund. Mayor Day calling it a flaw in the federal government system and how they calculate losses, even after he says he was promised the hospital would be included in the latest Phase 4 disbursements, which would also be based on budgeted numbers.
We're one of about 3 hospitals in the entire nation that has this issue. The issue we think happened is the hierarchy of HHS, appointed leadership, had not talked to HRSA, or there had not been as good communication between the two, and so the formula that they were using to compute these funds was never changed. We're due what we think is around $7.3, $7.4 million.
Mayor Day taking his 6th flight of the year to Washington, D.C. last week to ask the organization in person why those funds still aren't trickling down. TRMC staff also concerned about the lack of help and how they move forward.
We need the $7 million to continue day-to-day operations, shore those financial operations up.
Last week on March 14th, Alabama Governor Kay Ivey awarding $30 million to rural hospitals impacted by the COVID-19 pandemic, but Mayor Day says Thomasville will only receive a small portion of that. Both the mayor and hospital staff agree any funding is good, but the state funding doesn't compare to what they could be receiving on the federal end.
We just need the formula tweaked in a way that will allow us to get the relief that we're entitled to.
Governor Ivey is also asking where's the money. Her office calling HHS and the White House asking for help. Meanwhile, our calls and emails to HHS have not been answered. In Thomasville, I'm Blake Brown, WKRG News 5.